The main one is really preventing fertilization and preventing ovulation. This pill is most effective when taken immediately after intercourse. So the earlier you take it, the better. What's up, beautiful people? Welcome to another exciting episode of Pillow Talk with Dr. O. You already know. Yeah, and today I'm coming back at you with another exciting topic as always. I wanted to take this opportunity to thank you guys for your support, for following, for liking, for subscribing, for commenting. You guys are just the best. But I also want to remind you that we have a podcast, right? For those of you that don't want the commitment of watching a video, you rather listen to it while you're driving to work or you're cooking or something, right? There's podcasts. We're available on all podcast listings: Apple, Google, Amazon Music, TuneIn, everything. Just make sure to subscribe to those podcasts. Thank you so much. And don't forget to leave a rating, leave a nice rating, okay? Today we have something very interesting to talk about, right? So we're on the topic of contraception again, but this time we're talking about emergency contraception, and I actually have this here with me, right? This one is called the post pill, but there are other popular ones like Postino and other brands. Bottom line is, something you guys have to know about drugs is that every brand has its own name for their drug, but most times the ingredient is usually the same. The active ingredient in this drug is called levonorgestrel, and it's a hormonal drug, right? So basically, no matter the brand you're getting, Postino, Postpill, whatever the brand is, right, after Plan B, they have so many names, right? But all of them pretty much have the same ingredients. One thing you need to know for every drug is every company or brand has its own name they call the drug. Same thing, but different names, right? So basically, it's just like, let me see one popular thing, Coke and Pepsi, right? They're pretty much the same thing. Of course, they taste a bit different. Maybe that's not the best example, but you get the point. Coke has its own name, Pepsi has its own name, right? For pretty much almost the same thing. That's the best way I could describe it. Maybe not the best example. What is an emergency contraceptive pill? So take note that this emergency contraceptive pill is exactly what it means: emergency contraceptive. So it's not supposed to be used every day, right? This is not supposed to replace your regular contraceptive, and you shouldn't make it a habit of using this as your regular contraceptive. It is only for emergency purposes. So basically, maybe you are having intercourse, right? And of course you didn't want to get pregnant, but something happened during intercourse and maybe the condom broke, right? And you didn't know something, or even if you knew the condom broke, right, it's too late to reverse anything, then you can use this. Or maybe in unfortunate incidents like rape, right, you can use this. Or let's assume your partner was trying to use the withdrawal method of contraception, and somehow withdrawal refused to withdraw and story entered, right? You can use this. So there are many situations you can use it, but the point is, this thing should never be something that you plan to use. So you don't purposely not use other form of contraception so you can fall back on this. No, it's something that you only use in emergency, in unexpected circumstances, when you had other forms of contraception planned and it failed, or maybe for any reason you forgot to use contraception, right? You can always use this, but don't intentionally make it a habit to want to use it all the time. How does this work? So like I said, it's a hormonal medication, and there are different mechanisms by which it works. First of all, to understand how it works, you need to know, how does pregnancy happen? How do you get pregnant? Is it a miracle? Is it immaculate conception? So let me describe it for you now. For you to get pregnant, your body has ovaries, and inside those ovaries are eggs. So your body releases an egg or two every month, right? And when that egg is released, okay, your partner has sperm. So every time you have sexual intercourse, your partner releases sperm. Now, when the egg is released, it has to be fertilized by a sperm from your partner for it to form an embryo that will eventually become your baby. So for pregnancy to happen, egg must meet sperm to form embryo. For pregnancy to happen, so the last stage of pregnancy happening is after egg meets sperm, then there's something we call implantation. That is when the embryo that is formed now implants it, builds house, and locates itself inside the uterus, inside your womb. It just occupies space like, yes, this is where I'm staying for the next 9 months. So basically, that's what it's all about. That's how pregnancy happens. So now imagine that you have an emergency contraceptive pill. Of course, all forms of contraception, they have their own way of preventing pregnancy, right? But the way this emergency contraceptive pill works is that it either prevents egg from being released from your ovaries. So that process is called ovulation. So it can work by preventing ovulation. So it will stop the egg from being released from your ovary or interfere with that process. Or it can work by preventing fertilization. What's fertilization? When egg meets sperm and they are fertilized, right? So it can also prevent that. And the last result that this thing has, depending on the type of emergency pill you are using, is to prevent implantation. So it interferes with the lining of the uterus so that the embryo will not be able to build house there, right? That's basically what it does. So those are the 3 mechanisms that it really works with to prevent pregnancy. But the main one is really preventing fertilization and preventing ovulation. This pill is most effective when taken immediately after intercourse. So the earlier you take it, the better. If you take it, there are some that say that it's effective up to 5 days. But the truth is, no matter how long they say is effective for, the longer time it takes for you to take it, the less effective it is. So for example, if you take it within 24 hours, is most effective. Within 48 hours, still effective, but not as effective as taking it within 24 hours. Within 72 hours, which is the time that they recommend that you shouldn't take it past this time. So basically after 72 hours is no longer as effective. For some, they'll say after 5 days, right? Depends. You need to read the instruction on whichever one you buy, but most will say 72 hours. But even that 72 hours is not as effective as 24 hours. So you don't want to purposely just relax and delay taking things. If you don't want to get pregnant, don't just waste time and say, oh, I still have time, I'll buy it tomorrow, or I'll take it tomorrow, or something like that. No, take it as soon as possible after intercourse, right? So there are some of these pills, depending on the type you take. Let me just show you. Like the one I have here is just a single tablet for single use, right? So this is just one tablet for one use. So you just take one dose and that's it. There are some others that will tell you take one tablet today, take one tablet after a couple of hours, or take one tablet the next day or something like that. So you just need to make sure you read the instructions of whichever one like you choose to get. This pill is relatively safe, right? So you don't have to worry that, oh, if you use it because you used it a lot, it's going to affect your chances of conception. No, it doesn't affect your chances of conception. It usually doesn't affect your period. Some people may see like spotting maybe a few days after using it, right? Spotting means that you have tiny drops of blood that you can see on your underwear, right? It's not an actual period, right? So you just need to know that that's not your period, it's spotting. It doesn't affect your menstrual cycle. It doesn't cause any harm to your womb. The worst case is that you may get maybe lighter periods or heavier periods, or maybe your period might be delayed for a few days. So don't be scared that you might have gotten pregnant or something, right? It could actually cause your period to be delayed for a few days. However, if in doubt, you can always take a pregnancy test, right? If you think you may be pregnant, because everything is not always 100% effective, right? So you might have taken it and it didn't work out and you actually got pregnant, but that usually doesn't happen if you take it within the right time frame. One thing you must know though is this pill cannot cause an abortion. So you cannot use this pill to have an abortion, right? It only prevents pregnancy. It does not destroy or terminate already existing pregnancy. So now let's talk about the good side of the pill, right? What are the benefits of using this pill, right? So one of the benefits is that, like I said, it is safe. 2, it doesn't interfere with your menstrual period, in that it does not now make your period become irregular. So you still have your periods as usual. It's just that they may be heavier or lighter, maybe the next cycle, or they may be delayed for a few days, but it doesn't mean that your periods are now going to become irregular. Another advantage of this is that like if you found yourself in a compromising situation like rape, right, for example, you can actually take this pill so that you don't get pregnant and have to live with the nightmare for the rest of your life, the nightmare of getting raped for the rest of your life, right? So it's a sensitive topic, we don't like to talk about it, but it's the reality. You can actually take this pill within 24 hours or maximum 72 hours, and this will help to prevent pregnancy. And one thing you should know is if the pill eventually fails, right, so you took it and for whatever reason it didn't work out and you got pregnant, so rest assured that it's not going to affect your baby. The fact that you took the pill is not going to be any harm to the baby that is growing in your womb, right? Baby is not going to have any malformations or deformation, or there's not going to be any any harm to the baby generally just because you took the pill. So that can also be reassuring, so you don't start worrying that something is going to be wrong with the baby if you eventually get pregnant. So the downsides of using this pill, one of them is there's risk of ectopic pregnancy. So in the process of the pill trying to prevent implantation, right, it could actually cause ectopic pregnancy. Ectopic pregnancy, right, is pregnancy, any pregnancy that occurs outside of the womb. So if that embryo that we talked about implants anywhere else but the womb, it could implant in the tubes, it could implant on the way down, so it could implant anywhere else outside of the womb. Sometimes they even find it in the abdomen, right? It could implant anywhere. Once it's not in the womb where it's naturally supposed to be, then that's an ectopic pregnancy, and it could be very, very dangerous. But most times ectopic pregnancies usually happen in the tube, but it could be very, very dangerous because, you know, the embryo is not supposed to be in the tubes in the first place. So imagine that the embryo is really, really tiny and minute when fertilization just happens, but then that embryo is going to grow to a full-size baby. Imagine that happening in the tubes. So it wouldn't even get to that stage. Before it gets there, it will rupture, right? And that's what we call ruptured ectopic pregnancy, a medical emergency. Like, you can literally lose your life from it, right? So you want to be careful of ectopic pregnancy. If you notice that you missed your period after taking this, you might be pregnant, so do a pregnancy test, right? And if you did a pregnancy test and it turns out to be positive, you might want to do a scan, right, to make sure that the baby is actually in the uterus and not somewhere else, because there is risk of ectopic pregnancy when you use this. The other downside to using this and other oral contraceptive pills is that there's risk of blood clots. Okay, blood clots and deep vein thrombosis. So blood clots, they could be very dangerous, they could be life-threatening, especially if the clot dislodges and then travels somewhere else and causes a blockage and all that, right? So you want to be very careful not to use this anyhow. And then the last downside I want to talk about is just regular side effects, because every drug you take, every drug under the sun, even your regular painkillers, they all have side effects. So this one is not any different. It also has side effects. One of the side effects can be nausea, can be vomiting, can be dizziness, can be breast tenderness, right? So the side effects of this drug are not usually so bad, but they exist. Sometimes it can even be abdominal pain, so you just start having pain in your tummy, or sometimes it can be diarrhea. Like, they vary. To get yourself familiar with side effects of any drug, just always make sure you read the instructions on the pack. It will always have details of what the side effects are and all that. And then one last thing I forgot to mention was who should not take this drug. So if you've ever reacted to this drug in the past, if you have had any hypersensitivity or allergic reaction to this drug in the past, then you shouldn't take it again, right? But besides that, there's really no one that shouldn't use this drug, because the drug is relatively safe. It's a hormonal drug. For most parts, it's safe, right? But like I said, it is only for emergency. This is not a regular form of contraception. It's not an effective regular form of contraception. It is only for a plan B, like some brands call it, right? Only if you failed to use other forms of contraception during intercourse, that's the only time you should use this, right? So if you don't want to get pregnant after using the emergency pill and everything's fine, subsequently you should consider other forms of contraception. So you have so many other options. You have the IUCD. IUCD can be hormonal or non-hormonal. Non-hormonal one is the copper IUCD, right? You have the contraceptive implants, you have the contraceptive pills, so the regular oral contraceptive pills. Then there's contraceptive injections. There's like so many things. There's even this of course, for short-term ones, easy to use one, there's male condom, there's a female condom, there's spermicides, right? There's a variety of contraceptives you can choose from, but don't ever leave yourself in a vulnerable state where you don't use contraception. Remember, the key word there is emergency. This is not a regular contraceptive use. Oh, and I forgot to talk about the price. It's also affordable. It's very affordable. And depending on the country where you are, you probably need a prescription to get it, right? Thanks for watching. Please don't forget to click the subscribe button down below and share this video with anyone that you think needs to see this. Like I always say, your sexual health and well-being is equally as important as your general health and well-being. See you next week.